Hey everyone, Sylvia here from Two Hands, One Heart Massage Therapy and Pilates Clinic, and today we are going to be talking about trigger finger. Trigger finger is a condition that usually happens with women in menopause. It is it's when your finger gets stuck in a bent position. Men do get it, and my client is actually male right here, you've had it for quite some time, over a year now. You can just nod your head and let me know. It's been over a year, and we've been working on and off with the trigger finger, but we're going to do some Graston technique. So what trigger finger is there's a ligament that comes right into here. The tendon comes across and through and attaches, and it's usually the thumb, the second or the middle finger that happens. So basically you bend your finger and then you're trying to pull the finger back and it gets stuck. So I have put paraffin, he has been soaking in paraffin and to warm up the tissue. So really deep moist heat. And now we're going to do some massage in there, but we're also going to incorporate some Graston in there. Okay, so finger stiffness is usually in the morning. A popping or clicking sensation as you're moving your finger. Move your finger. Yeah. There's usually a tenderness or a bump or a nodule, which is right in here in the palm at the base of the affected finger. And the finger catches or locks in a bent position, which suddenly pops straight. Boom! Classic trigger finger. Love it. Then we have the finger locked in the bent position, which you are unable to straighten, so as you just saw there. Okay, so it is an inflammation which narrows the space within the sheath that surrounds the tendon in the affected finger. And if it's severe, your finger becomes locked. Now, he is still able to move, but there are times when he is excessively typing and he works about 12 hours at a desk all the time. And he's also a guitar player. So he's does a lot of repetitive movement. So I'm going to take my Graston tool and I'm just going to do a little bit of fanning. So I just want to feel and I can already hear, and I'm going very light, but I can really feel all the granulars. And I'm just going to take it right up into the hand. I'm going to apply a little bit of some emollient just to warm up. And I would be working the whole entire arm because you also want to work the muscle and not just onto the injured site. So I'm just going to do quickly some fanning and stroking techniques. And it's very light. And I can even feel there's a little bit of crunchiness going on in there. I'm really using layman's terms, which is always crunchy bits. Give it a good fascial stretch. Okay, and then we're going to go a little bit deeper into more specific techniques, and then we're just going to do some cross fiber. Is that comfortable? You can put thumbs up. The other thumb. Yes, thumbs up, it works. So, Graston techniques, you are only doing them for 8 to 10 minutes. I like going on all directions and pulling into the finger. And treatments are usually 3 times a week, even every other day, and they're 10 minutes long, so you can incorporate them. I would do like a full half-hour treatment, so you can incorporate the forearms in there just to address the whole area. Right now we're being very specific. Yeah, and then I'm just going to get you to bend. And then I'm just going to hold on and you're going to open your finger. There you go. And then again, Yeah, and go again. Beautiful, and again. So it's really amazing, and this is the first time I'm actually doing this specific technique. I'm actually pressing down on that region, and he's opening his hand, and he doesn't have any problems opening his hand when I'm putting the pressure on there. That is new, correct? He's shaking his head, yes. Beautiful, and then just relax. We're gonna go cross fiber again. I'm gonna get right into the whole mid finger. I'm going very light, it's not that deep. And then I'm gonna go across. So I like to get the whole entire area just to make sure we're getting everything. Now, I'm going to do a nice little fascial stretch here. I can just stretch the hand. So home care is really important too. And it's interesting, you can see how there's a bit of a difference here. Okay, let me just relax. So we've been at this for 6.5 minutes. And turn your hand. And we can even just do a little bit of getting into everything. So home care for trigger point is lots of stretching. Lots and lots of stretching. Okay, so we're just gonna add one more little tool here and just giving it, so this is the double bevel, and I'm just gonna do a little, I mean, who would love to get their hand massage? Not holding the instrument very correctly. I can also use the tip with the shiny side up. And again, going cross fiber. Just turn your hand this way so people can see what's going on. There we go. Okay, so let's just see. It's not instant. I just want to let you know this is not instant. He's been having this problem for quite some time, for over a year, and we're just really starting to be more diligent about treating it. Okay, and then close. So a little bit better, not as stuck, and full fingers. Nice. So it's how he actually wears when he remembers. He does have a finger brace that he wears at nighttime, but he's not very diligent, as most people, about doing their homework. So his homework is really to stretch, stretch, stretch. And I think that's all we need to share with trigger finger. There you go.